the role as communicator. A doctor should be a communicator part.
Yes, communication plays a very big role. To be able to listen. So, communication is not necessarily about talking, but it's also about listening and being able to give feedback, being able to transfer information and being able to also receive information.
Doctors should be able to communicate. They should be able to tell the patients the right information, well packaged for the patient to understand. That is using simple language that the patient can understand. Being able to listen to the patient. And even within the teams, they should be able to communicate or to relay their ideas, thoughts, findings, and other things into the team's discussion for instructions to the nurses or to any other provider that they're working with on the team.
Verbal expression is very important for medicine and for all aspects of human behavior. So, how can you make a diagnosis if you cannot communicate effectively with the patient? How to listen to the patient? How to put questions that will help the patient give the information that are needed for diagnosis. So, communication with the patient. You may be able to communicate with the patient, but maybe not about family issues. How to communicate with the patient so that you have the background on family issues that can help you to identify the problems. You can communicate in your office. What about going to the community? Are you able to communicate your immunization program, how the family is compliant, and actually have interaction with the community? All those skills are necessary for the modern doctor.
And so being a communicator is about accepting people. It's about expressing ourselves as carers, as advocates. To be a professional, what is a good doctor good at? A good doctor is good at communicating. But what does that mean? They use language that's appropriate for the setting or the individual. They modify their language. We know that doctors spend more time consulting with patients who they associate with in terms of belonging to the same strata in society or same social class. And they spend less time consulting about exactly the same condition with people from a lower strata in society or lower social class, by and large. And that cuts across communicators. And we communicate verbally, non-verbally. And if we look at the non-verbal stuff, we leak all sorts of things. We leak prejudices in the way that we express ourselves, the faces we pull when people tell us things that we find difficult, that are out with our experience. We leak things in the language that we use. So we have to be very careful about being prejudicial in the language that we use, the communication that we use. And in the North, there's some really interesting work that shows that male doctors who are judged by patients as good communicators use patterns of speech that are associated with women. They use female patterns of speech, are much more empathic and much more empowering and much more compassionate. So they would be all the facilitative noises and expressions like oh, oh, yeah, oh, I see, and much more reflective, oh, so it was that bad, so you waited that long, those kinds of patterns of speech. And so what's important is that patients value those things, they value those patterns, and that goes for written communication, letters, discharge letters, referral letters. So there's all sorts of things about communicating efficiently and effectively with members of team, and communicating respectfully. Mm-hmm. So you don't shout, "Oh, you try and find out names of people, and you thank them for giving you time to communicate. You ask them if you can talk to them at the moment, if it's convenient." Yeah.
So the doctor comes from the chair, which in Latin means to teach. Actually should be also able to teach medicine, not so much maybe in classroom, but at least to train people, those your colleagues or those who come for clerkship, residents, and all the people. How are you able to transmit knowledge and skills to those people? So actually for the advancement of medicine, all doctors should be able to communicate and transmit their knowledge and skills, and those who have the knowledge and skills can advance further with new skills and new knowledge that is the not progress. So it's important actually in the Hippocratic Oath that you teach other people so that medicine continues to improve in quality of healthcare based on the improvement of healthcare providers.
One of the tasks that we often give to our medical students is that you give them a case, you give them a complex case story, and then you give them a telephone and you say, you've got less than a minute on the telephone to tell me the key important things about this patient. And the student goes, yeah, I've got this case of this man. Yeah, this man. He's about 40. Actually, I think he's 45, and he was admitted. When was he admitted again? This afternoon. He was admitted this afternoon with 2-day history of central kind of round about his tummy button, periumbilical pain. You know, and they've already taken up the minute, and they failed to give you the important bits of information that you need.
So being a communicator is really part and parcel of good practice, because you have to be able to get feedback, you know, to complete the cycle. So if the information you are sending is not right or is not well packaged, or if you can't listen for what others have to contribute, or if you find a problem and you can't put it in a manner that the decision makers can understand and help in the intervention, or you're going to the community and you are way above the level they can understand, then the chances of success are really very minimal. So being able to listen, being able to package information, being able to work with others requires communication.